Hey guys, welcome to my channel Pharmacy with Preeti. In today's video, I will be covering the renin angiotensin system, also called as renin angiotensin aldosterone system. So this mechanism is important to understand because it plays a very much important role in maintaining the blood pressure, fluid balance and blood volume, especially for those patients who are suffering with the health conditions, chronic health conditions associated with the high blood pressure, heart failure and kidney failure. Again, this mechanism is equally important to understand what are the different drugs and how these drugs will show its action by affecting these mechanisms. So let's begin. When there is a reduced blood pressure or reduced blood volume, when there is a reduced blood pressure or reduced blood volume or electrolyte imbalance, then the juxtaglomerular cells of the kidney will convert the prorenin into the active renin. This renin is an enzyme which reacts with the angiotensinogen, a alpha 2 globulin protein found in the blood plasma, act as a precursor for increasing the blood pressure, blood volume and the electrolyte balance. Now this enzyme renin, this will react with angiotensinogen, a plasma protein, to generate inactive angiotensin 1. Angiotensin 1 is a decapeptide and it is considered to be inactive. However, its potency is 1 by 100 times less than that of the angiotensin 2. Angiotensin 1 gets further converted into angiotensin 2 by an enzyme called as ACE, that is angiotensin converting enzyme, commonly found in the vascular endothelium of the lungs. Angiotensin 2 has a major bioactive role. It is an octapeptide with active proteins in it. And it shows its action by inducing vasoconstriction, that is the narrowing of the blood vessels and arterioles, thereby increasing the blood pressure. Further, it will stimulate the adrenal gland or adrenal cortex to release the aldosterone hormone, which will act on the distal part of the convoluted tubule of kidney, thereby promoting the sodium and the water reabsorption with the loss of potassium ions in the urine, thereby increasing the blood volume. Now this angiotensin 2 will also stimulate the hypothalamus to release the antidiuretic hormone, ADH hormone or vasopressin from the posterior part of the pituitary gland. Vasopressin is, as the name suggests, it has a vasoconstrictive effect. It exhibits the vasoconstriction properties, but its main action is to stimulate the distal part of convoluted tubule to promote the reabsorption of water in the kidney. It also acts on the CNS to increase the individual's appetite for the salt and to stimulate the sensation of thirst. The T half the T half of angiotensin 2 is just 1 minute. That is, after 1 minute, 50% of the angiotensin 2 is utilized. The renin is considered to be a rate limiting factor for the angiotensin 2 release, and it has a T half of just 15 minutes. Angiotensin 2 gets degraded into angiotensin 3 by an enzyme called as aminopeptidases. So here angiotensin 2 gets degraded into angiotensin 3, which is a heptapeptide, by an enzyme called aminopeptidases. Angiotensin 2 and 3 both will stimulate the aldosterone secretion from the adrenal cortex, thereby increasing the blood volume. Angiotensin 3 is further attacked by another aminopeptidases, resulting in the formation of hexapeptide called angiotensin 4. Angiotensin 4 has a different action centrally and peripherally. Angiotensin 4 has a different action both centrally and peripherally by acting on the 84 receptors. Further, angiotensin 4 and the some part of angiotensin 3 are broken down into inactive fragments by a peptidase named angiotensinases. So, if the function of RAS, that is renin angiotensin aldosterone system, gets abnormally active, then the blood pressure will be too high. So, there are several types of drugs such as ACE inhibitors and direct renin inhibitors, which will interfere with these mechanism in order to improve the blood pressure. So till now we have learned the basic mechanism. And what is the purpose of the same. I will make a separate video covering the different types of drugs which will interfere with these mechanism. The reference is K.D. Tripathi, chapter name Drug Affecting Renin Angiotensin System and Plasma Kinin, page number 495. Thank you.